Welcome to Global Development Interrupted. I am Leah Petit. And if you have ever wondered what global assistance did for the world and for the United States, then you are in the right place. Today, we're going to be talking with Mananza Koné, who is a localization officer at the USAID mission in Côte d'Ivoire. But before we get into her story, I do want to talk a little bit about the words and phrases that are used in this episode. So the first word that you'll hear quite a bit, and I've already said it, is localization. What that meant was a shift in how the U.S. government funds and partners with the entities that were implementing the programs on the ground. So instead of relying heavily on international organizations with headquarters in the United States, we're thinking about how do we put more decision-making power and resources directly into the hands of local partners, those being community-based organizations, civil society organizations, local government, national government, essentially saying, how do we empower the people closest to the work? How do we make development more effective, more equitable, and in the end, more sustainable? Mananza played a key role in localization. She was also a Foreign Service National, or FSN. And all that means is that she was a local expert that was hired by the USAID mission in Côte d'Ivoire to design programs, advise US staff, and ensure the communities were being represented in the work that USAID was doing. So often, the work and the leadership that FSNs provided for USAID programs around the world are not talked about, not seen. They were the backbone of almost every single program. And so that is why I'm very happy today to share Mananza's story. So let's go meet her. Hi, Manza.
Hello, Leah. How are you?
I'm good, and I am delighted that you are on Global Development Interrupted. Can you tell me where you're calling from?
Yes, I'm calling from Abidjan in Ivory Coast, West Africa.
And what was the last title you held before USAID was dismantled?
Okay, I was officially the local partner management specialist at USAID Côte d'Ivoire office, and but I was called Mama Localization.
Mama Localization. That's such a nice title. So how did you enter USAID and become a Mama Localization?
I saw this opportunity with the localization position at USAID Côte d'Ivoire, and it was a new position. So it was a position that I helped, grow, because I was the first local partner management specialist for USAID, the first localization position in Côte d'Ivoire. And we had to think how, we're going to develop this position, making sure that we have all the capacity to reach out, to support, and to make sure that everything that we're doing is sustained. To make sure that we can build this trust with the local partners.
Why is it important that local organizations do the work rather than an international organization?
I think we want sustainability, we want ownership, we want to make sure that the structures that exist in the country, the people from the country, the systems of the country are well ready to receive all the support that is coming to them. And by having a local partner being in front of the decisions that are going to be made, being able to instill, to adapt, to talk, to prepare the community, I think that they are the best to be at that position. Everything was not perfect, but I think we started and we saw very good results.
So I'm hearing from you that local partners are a better use of USG funding because they're more effective in understanding the context of their community and how to apply funding to programs that would be more quickly utilized by community members. What was the feeling from the local partners when suddenly they didn't have the funding anymore from the US government so abruptly?
I'll say disbelief at first, because it's a long relation, and it's been a good relation. It's been a trustworthy situation. And USAID did not itself know, how to go about a lot of things in that process. So the local partners at the beginning were not receiving all the answers. And they were also trying to calm down the community, the beneficiaries, the local leaders, the community leaders who did not really understand what was happening. Some partner, um, leaders of their institution were also uncomfortable on the type of message that they have to convey to the employees. What do you do? People were working and suddenly they are not working. What does it mean? Does it mean that what we did not matter? These were all the questions that came. And so I think to me, this has been the hardest.
And what kind of services ended abruptly? When we say funding stopped, what did that mean for services?
Project with sex workers, HIV prevention for sex workers, those projects, women, vulnerable young women. Also, this project unfortunately, did not last. Orphan and vulnerable children. Also, this project did not stay. But basically, in Côte d'Ivoire, these were our main projects. So few states, the supply chain project could stay, and which is led by a local partner. So we are very proud that this project could stay. We are happy about that. Mostly the clinical part of the project are there. So there is something, at least. Nothing has totally disappeared. And I think people have learned to integrate activities and also to know where to go about getting the information and the support needed. It's important to say that, communities are really resilient, local partners are.
It sounds like there's been a step back and it's again a bit bare bones, a skeletal framework of what it used to be. But
Yes.
communities are resilient and it sounds like people are working even if they're not being paid because they care. What do you say to the point of view that, well, maybe this is really great. Maybe we needed to see US foreign assistance step back so that country governments could step forward more aggressively?
It's difficult for me to agree. No government is inactive. Every government work and have their agenda, they have their strategy, the yearly strategy, the 5-year plan, the development strategy, the health strategy, reproductive health programs, support, everything. Foreign assistance exists. It's part of what has to be existing to bridge, to help, to grow, to develop, so that countries are supported and also work is done and technicality also comes within that foreign assistance. If it was not needed, it wouldn't have lasted so long. And we have to look at what brought to our local institutions, to our communities. It's complementary. And definitely, we know that the assistance fades away. This has been happening for the past 10 years. We know that it is fading away. And it is in that process that localization was a positive thing. It was to prepare the structure. So it's not to be, and definitely recipient of foreign assistance. But I think that the way it was being shaped, it was a clear message that national civil societies had to be strong in order to support what the government is doing. And it was going to fade away like that and prepare for the structure to take, part of the continuity and the sustainability. So I don't believe that this is the way things should have been done. It was a bit premature. We did not have the time to prepare it. So I hope that the assistance continues. It may take different formats, different shape, but it is needed. It is needed. It has its power. It has its value. It has its reward. And I think what it did for the US government all over the world, it's incredible. And I believe that we need to keep that in mind. We through USAID, we could open trust, we could instill trust, we could help solve issues on a global it's a global network. If we had not had all of that support for each one of the countries, we could not be where we are now. And I think it's important to keep that in mind when we talk about foreign assistance, because I do think that a lot of people do not understand what it is. And if this is not even clearly taught, explained in countries and also even in the US, because a lot of people do not even understand what it means, foreign assistance. And I think that we have to also work on that. We have to work on that to communicate what that foreign assistant did, changed, brought to the US and also to the countries.
It's almost a better word would be global partnerships and investments.
Yes.
I mean, because you're
Yes.
talking about investments in workforce, investments in systems.
Yes.
And I agree, Manza. I worked as well in localization, and we understood that funding was not a consistent. It was fading out. And we were working to prepare both local governments and local organizations to work together in a stronger system. And I really appreciate your point about there is no government that is inactive. It really was a partnership with the US government. So, Manza, what is the thing that worries you the most, though, now with this breaking of this partnership between the US government and countries, especially in Cote d'Ivoire?
I will say that everything is left, I want to say, hanging. We did not invest so much in people, in systems, in partnership, in communities for it to just be, I mean, I don't know how to say it.
Waste.
It shouldn't be a waste. I don't think all these years that those thousands of people worked for has to go to waste. What I did should not go to waste. What you did should not go to waste. What the health worker, the community worker, the local partners, the government, all those meetings, all the skills, all the trust, everything is still there, has a value. We can continue to work. We should find the ways to work. We should find a way to keep it. We should find a way to achieve the goal that we had, and it shouldn't stay like that. To me,
I agree. And when you think about the future in terms of the short term, what would you like to see with what's happening now, what's being rebuilt now within your country and with other funding sources?
I think we had this issue of many partners in one country doing the same thing. We had this issue about duplicating efforts, money, spend somewhere too much and not enough somewhere else. We had this issue with coordination. We had this issue of training the same people. Everybody wanted to have that same one community worker,
Also the same organization.
the
Yes.
same organization. I think, to me, this is the time to think differently. We need to be strategic. We need to think out of the box. We need to be creative. And this is when we need to listen to the communities, because they are going to be the one working and building that support system. And we need to be able to support them in thinking that way, but also having the donors come to think like that. We need that thinking.
So what I'm hearing from you is, all these roundtable discussions with all these experts. What we really need is to go to the community and say, what are your priorities? What do you need to ensure that your community is resilient? And then think through, okay, how can we do that together? Is that what I'm hearing from you? Let's start investing. Let's start investing and
Yes.
listening to communities now
Now,
and build out our strategy that way.
because sometimes you will hear that, but there was money.
There was
So
money.
there was money.
Yeah.
So we were listening in a different way. Right now, there is a big pot of money that is not there. What do we do?
How would you do it? Let's say the Gates Foundation is like, hey, Manza, we want to give you a bunch of money. But first, what's your strategy?
I think we need to take the time to go and build that strategy from the grassroots, because I think that's we had a way. I'm not talking USAID only, but I see the way people usually work. At this point, we have to look at how communities have been struggling and how did they survive, and how can we give more power to the survival means and ways that they used. And this is what we need to strengthen, not to come and say, but there is another way, which is the way that we think we're bringing to you. Right now, people are being resilient. How do they survive? What do they do? I think that this time we have to go and look at what really happened on the ground.
You're bringing up an excellent point. There was funding that came in, created community projects, but what remained? Because it crumbled. So, what are the things, what are the activities, what are the systems that stayed that communities continue to rely on? And let's go
Yes.
look at those.
Yes, yes. We really need to invest in that. How do we see what the community has done? And then now we maybe create another type of assistance. The funding can be there, but maybe instilled differently, shaped differently, designed differently. And maybe that would be good, because it's not about having a pilot project. That's not what I'm saying. But it's really, going from communities to communities, understanding that it's not a paste and copy, but it's more of in-depth intro community work by them, for them, and through them. And then we can be there to support.
Manza, this is why everyone loves you. Mama localization. Because
Oh, thank
it's true. We don't need pilots.
you.
Communities have been resilient for years. What are they doing? How are they surviving? Let's go look at it. And let's say, okay, this looks great. How can we support you to make it even better? Agreed. Is there an example that you're thinking of right now in terms of resiliency in a community, a specific activity or an NGO that you have been impressed by during this time?
In order to make sure that prevention continues and care and support continues, we have seen that the referral system is really the one that is alive.
That's amazing.
Yes, because people need care, and that should not um, that should not be something that is abandoned. So basically, this is what I've seen, moving.
And can you explain to listeners what the referral system is?
It's making sure that when you have a client or when you have a patient, knowing the whole continuum of care that it has to undergo, from making sure that it has the appropriate care, the medication, the appointments, the delivery of the medication, the support is not interrupted. We had local partners working, making sure there was a good follow-up for those patients. Today, they are no more there, but the patient is there. The health sites are there. But it was important to understand that it's the community workers, the community leaders that are there are the one who always will bring attention if anything is not functioning. And I think because of the responsibility that those local partners that were in those areas have, there is this accountability. So the accountability is very important for the local partners. Even if they are not there, they made sure that all the information was passed to make sure that it continues. And we're happy that PEPFAR could pick, this portfolio and help us continue what we have started. So today we have 3 former USAID staff with the PEPFAR team. And we keep on telling them that you are the legacy. Make sure that, all the work is not forgotten.
What you're saying here is important because even though we are grateful that PEPFAR is still around, we're also seeing that there's just a focus on clinics and medication. And what you're saying, which is incredibly important, is that referral mechanism and all of the social aspects of getting the individual to the clinic is just as important as getting the pill to the clinic to be received by that person.
Yeah.
And that arm, that social community arm, has been
Mhm.
removed.
It has been removed, and we should never forget the profile of our communities or the countries that we're working in. We should never forget that. Sometimes you hear, yeah, people are not going to the health center. People are not going to the health center. But when you work in development, you should always keep in mind everything that has to do with the sociological profile of the country, the level of education, the way people communicate. There are so many factors that we need to keep in mind to understand how you just tell people go to the clinic and they go. It doesn't happen that way. It doesn't happen that way. And I think that's where the emphasis on uh, knowing your people, knowing your community, your habits. Even if we are people say the global village, everything is globalization, whatever. People are still in the village and people are still in the communities. People are the way they think, the way they organize. There is a reality. You have a lot of social taboos. You have a lot of things that we need to take into consideration to make sure that we slowly break those barriers to get to where we all want to go. Even if you have universal health coverage, all of that can be there, but people may not use it because you need to prepare them to understand what it means, how you go about it, what it will do to you.
Well, and also use social norms for positive health seeking behaviors.
Definitely. So I think that the community piece is very important. It is one of the indicators of how your project work.
And why local entities were so important.
Definitely.
All right. Well, Manza, what would be the one thing from this conversation that you want listeners to take away?
This is, to me, a time where we need to make a difference. I know that it's been a struggle. I think I should say it. It's been a struggle. I don't think we all had time to realize what was happening.
We
It was,
definitely did not, Manza.
yes.
When you talk about confusion, we were all confused. Yes.
We did not have time to prepare, but also to, I shouldn't say grieve, but to breathe. Maybe grievance is too big. We should not forget that we have built a strong network locally, regionally, at the international level. This is USAID. People are ready because of the work we did. The systems are ready. We supported them. They exist. We have connections. We need to make them. We need to think of mentoring. The funding is not there, but the south to south mentoring is there. It's cheaper. We can have partner helping us to do that. We need to make sure that we find a way to sustain what exists and that every action that we're going to do right now, it counts. I think that together we can save lives. And this to me is very important. We can save life. We have the skills, we have the intelligence, we have the people, we have the structure. To me, it's not over. It's not over
I
yet.
love that. I love what you're saying. We have the talent, we have the systems, we have the network. It's a call to others to invest in that so it is not a waste.
Definitely. We are not lost.
Manza, I have truly appreciated this conversation with you. I'm so glad that I got to learn a little bit more about mama localization, and the call to invest in all of the talent that we have been working with for decades. So thank you so much for coming on.
Thank you, Leah, for having me. Thank you very much for, trying to represent all the work that the FSNs have tried to do, during their time at USAID. We've been proud to be part of this adventure. Thank you to all the leadership. Thank you for instilling in us that accountability. It's important. And I think we continue. We continue to do it everywhere. We'll continue. Thank you again.
Thank you, Manza. This is Leah. Thanks for joining me. If you enjoyed this episode, follow Global Development Interrupted wherever you get your podcasts, and subscribe on Substack to get new stories and updates straight to your inbox.